the nerve root. So, shot. Alrighty. So we're just on the lateral margin of the disc. I'm gonna can feel a herniation there. Shot. And before I do that, I want to try to get a little more medial. I'm feeling the facet right there. Shot. So I'm getting as medial as I can. Shot. Shot. Are you okay? Shot. I'm going to try to come a little bit more lateral. How's blood pressure? Good. If we can keep it a little bit lower, I'd be even happier. Shot. Yep. So our first step here is to really get down to this L5-S1 herniation, where she's having the pinch nerve and the back pain coming from. And to do that, I'm gaining access with a needle. It's called a spinal needle. Shot. I'm right up against her facet joint. I'm going to back up a little bit and try to redirect around it. Shot. Shot. That felt pretty good. It's a little higher than I want to be. Shot. Shot. That's better. All right, let me know when you think she's awake. Let's get an AP view on that. So I'm using the needle to track a path that's a safe path that goes under the exiting nerve root so we don't damage it, that goes right under the nerve root and into the herniated disc. That's looking pretty good. So we're well underneath the exiting root. Show them where the exiting nerve root is, right under the pedicle there. Let me know when she's awake. Show them the pedicle of L5, yes. Now show them the bottom of the pedicle, there. The nerve root is leaving, wrapping right around there. So we're well below it. Are you awake? All right, we need to know if you're having any pain. Just say ouch and tell us if it's in your back or your leg, okay? Lateral view. Oh, good. Shot. Looking good. Are you uncomfortable at all? You okay? All right. We need you awake for this first part. Okay? I'm going to give you a little more numbing medicine, okay? And then we're going to get that other disc. Now, yeah, that's the needle going in. You're very sensitive to pain. It's understandable. I just gave you some more numbing medicine, okay? Can you hear me all right? Everything's going perfect for you, okay? There's no problem. You're awake for the beginning while I get into the two painful discs, and then we're going to put you to sleep, okay? Now, how long have you had your back pain for? Sean? I didn't hear that. 9 months? All right. And when did you start having leg pain? Sean? I didn't hear what she said. Sean? I got to have you tell me what she...
Back pain?
Not back pain, she said we said 9 months. Sean? How about her leg pain?
You got leg pain? Yes.
Sean? How long? Same?
9 months.
All right. Sure. AP? So I could feel the herniation right there where the tip of the needle is at L4-5. Yeah, we're going to get you fixed up. And you're going to get a copy of your surgery so you can watch this whole thing. It's going to be pretty cool. Lateral. Huh?
She can't. She doesn't know if she can watch it.
Oh, you'll be fine watching it. All right. Well, there's not really any blood, to be quite honest with you. There's just a few drops. Okay. All righty. So we're going to put you to sleep in just a minute, but I'm going to draw on your back first, okay? So just so you have the benefit of knowing what we're doing, you have 2 herniated discs on the left side. And the herniation comes from a tear in the wall of the disc called an annular tear, and then the jelly from the center is pushing out through that tear, and it's hitting on your nerve roots. That would be your L5 and S1 nerve roots. Okay? So the nerve roots come down from the spinal cord, then they go past the back of the disc and down the leg. And your L5 and S1 nerves are getting pinched right where the herniation is. We're going to go in and remove the herniation and clean the tear from which the herniation came out. If we don't clean the tear, you're still going to have back pain, and you're going to have more herniations in the future. And that's why the Deuk laser disc repair is unique, in that we clean the tear. It's called an annular debridement. All right. So she's had back pain for 9 months, we said?
Yeah.
And leg pain for 9 months. Lower back pain and left lower extremity pain. Are you comfortable? Yeah? All right. We're going to put you to sleep soon, but I gotta check something first, okay? All right. How bad is that on a scale of 1 to 10? What's the highest it went? 10. All right, that's a 10 over 10. Is that where you typically get your back pain?
Yes.
Okay, we're going to fix that. When you wake up, it'll be gone, okay? Show them the herniation. So take a look at this x-ray. Jordan's going to show you the giant tear. Show them the tear. Good. And show them the herniation. Look how far back it is there. All right. You're okay. We're not doing anything yet. Where are you feeling pain? All right. That's one of the bad discs we're going to fix. That's your L5-S1. Okay. That was a 10 out of 10. L5-S1. Shot? You can take whatever breaths you want. We're going to put you to sleep in about a minute. Are you ready? Let's put her to sleep. How bad is that on a scale of 1 to 10?
10.
All right, that's your second disc. Thank God we're fixing both of them. And that was, is that where you get your back pain typically?
I think so.
Yep. We'll fix both, okay? You're going to go to sleep now. I want you to count from 1 to 100 out loud.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
If you get to 100, I don't have to pay the anesthesiologist today. It's funny that if they speed up, they don't want me to pay you. If they slow down, they do want me to pay you. That means they like you, right? Okay, so we've tested both discs, 4-5, 5-1. They're both causing severe pain. And we're going to fix both of them. You can see the herniation in the back of 4-5 as well. We're starting with 5-1. Yeah, you're okay. Everything's all right. Don't move. You're doing great. So she's still going to sleep. We're using propofol sedation to put her to sleep. Now this is what I'm going to run down the guide wire. This is going to spread the tissues and allow us to do this atraumatic surgery. We're not cutting anything but the skin. Everything under the skin, nothing gets cut. It just gets spread. Spreading tissues doesn't harm them. Unlike open surgery like microdiscectomy or laminectomy that causes massive destruction of the spine and soft tissues, this surgery doesn't cause any destruction or damage. Shot? Man, that's a big herniation. All right. So we're almost inside the disc. We're going through their tear, the painful tear right now. Shot? Okay. It's a big tear. geez. It's a huge tear. Which I could tell based on her MRI. I mean, I can almost push this thing in. So, the tear in the back of the disc is called an annular tear. That's the cause of all herniations. If you don't get an annular tear, you can't have a herniation. Shot? Because she has a tear back there, the jelly from the center has come out.
Good.
Mm-hmm. You feel how easy that went in? Yeah. Huge tear. All right, we're going to start with L5-S1, and then we're going to move to L4-5 next. Take a look at this, folks. The whole surgery is being done with a 1/4-inch incision. We're not taking any bones or ligaments out of the spine. It's all natural. It's done with a laser. Thank you, Luis. Let me show you the laser real quick, or the endoscope. This is an endoscopic surgery. It's done with a high-definition camera, an endoscope. It's got a working channel, light source, irrigation, and through the working channel is what I do all my disc work. We put the laser through there, and we put the grabbers through there. Okay, let's go to an endoscopic view. We are looking inside the disc right now. I'm going to improve the focus. There we go. Thank you, Luis.
Thank you.
We have a constant irrigation. Can I have you lower the IV pole just a slight bit, or move it if you don't mind moving it towards you? Laser. Now, I wasn't able to remove much herniation yet. We're going to bring the laser in and get started with the laser part. Now, this is our 4th surgery for today. We've already done 3 others. Wipe. Thanks. Let's go ahead and show our audience, why do herniated discs cause back pain and leg pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. So you can see from our video that back pain comes from a tear in the back of the disc called an annular tear. And there's inflammation in that tear that causes pain. Inflammation itself causes pain. If the inflammation occurs in a part of your body where you have nerve fibers, painful nerve fibers, you're going to get pain. If you have an ingrown toenail, that's an inflamed toenail. It hurts like heck. If you have a tear in the back of your disc in the neck or back, and you get some herniated disc in that tear, it's just like having an ingrown toenail, but in your spine. We're here, look at this herniation right here, the blue stuff. The blue stuff is the herniated disc. It's the herniated nucleus pulposus. And I'm removing it with the laser. The laser is really the best tool in the world for doing this. No other tool works. So here's the end of the tear. There's some epidural fat. And we're going to clean this up. This is all herniation right here. Bulging out, hitting on her nerve. The nerve is just to the left at 9 o'clock. The 9 o'clock position. I'll show it to you when we're done. It's probably going to be buried in fat because normally the nerve is covered in fat, and that fat protects the nerve and cushions it, like padding. That's what we want to see, is healthy fat wrapped around the nerve, covering it, protecting it. Unfortunately, the herniated disc is literally just below the nerve, and it gets on top of the nerve and pushes on it. I should say it gets underneath it. It's a little more accurate. This is all herniated disc right here. We're inside the herniation, inside the tear, within the annulus, and we're literally removing it. That's a big globule of fat just getting in the way. The fat itself is not the problem. So sometimes fat just gets in the way and it blocks our visibility of what we can see. So here's the tear right here. Now the blue dye that you're seeing stains to degenerated nucleus pulposus. The nucleus pulposus is the jelly from the center of the disc. That's what's pushed out through the tear. And the fact that it's blue tells us it's degenerated, which means the inflammation of this process has changed it. Normally it's white and it doesn't stain blue, but it's turned it into a blue-loving material because it's degenerated. And what causes the degeneration is the inflammation. Without inflammation, the nucleus does not degenerate. Normal nucleus is not degenerated. It doesn't degenerate, it stays white. Only degenerated nucleus turns blue when you stain it. Non-degenerated nucleus stays white. So the dye helps us see the bad stuff from the good stuff. It guides my surgery. This is a very state-of-the-art type of surgery. You're not going to see this done everywhere. It was pioneered at Deuk Spine Institute. Endoscopic spine surgery is becoming more and more popular as it's minimally invasive, doesn't require incisions that are big, doesn't make bleeding occur. Now look down here. See the white stuff? That's normal nucleus. That is perfectly normal stuff. We want to leave it there. This is a young lady. She still has normal disc, and we don't want to mess with the normal part of her disc. But we are going to get rid of as much of the degenerated disc as we can. Just about done with this one. We've got one more to do. The L4-5 is next. I'm going to try to get a little more of this stuff out. Any questions from our audience?
No current questions.
So Henry, let's show the audience, how does the Deuk laser disc repair work? What are we doing here with the Deuk laser disc repair?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, folks, so you've been away, you've learned about the Deuk laser disc repair. I just want to show you this. This is her normal part of her disc, the nucleus pulposus core. And we cleaned out all the blue stuff, and there's a little bit of fat here. We're not going to mess with it. Her nerve is right there, the white thing, just below the laser. And it looks good. We've gotten all the pressure off of it. All that has been done endoscopically. All right, let's go ahead and shut off the scope. We're done with the L5-S1. We're going to move on to the L4-5. So a lot of healthy disc left there. We didn't have to remove all of it, but you can see that's what a normal disc looks like. And the only reason we can see that is we're inside the disc, endoscopically. Honestly, this is the only surgery in the world that lets you see inside of a disc. So I was able to remove all the parts of the disc that needed to be removed. Yeah, one more. And the parts I removed were the blue staining parts. Of course, the blue dye is our special Deuk spine dye. And it basically stains to the disc that has to be removed. So I got rid of all that. What we're left with is healthy disc, which will heal in time. Her back pain will be gone after the surgery. Her leg pain should be gone. It'll take time for numbness to go away. Numbness always takes 6 months to a year to resolve. Weakness takes 6 months to a year to resolve completely. But the pain usually goes away immediately. All right, we're going to start on the next disc, which is the L4-5. Now remember what I told you earlier. She has 3 discs that are abnormal and damaged. L3-4, 4-5, 5-1. We're only fixing L4-5, 5-1. We're not doing L3-4. The reason is that the L3-4 disc is small herniation. It's to the right side. She's having no right leg symptoms. So I determined that that disc is not symptomatic, does not need treatment. But the L4-5 and the L5-S1 definitely need treatment. And we just tested them a minute ago, and sure enough, the discogram, I can't see what I need to see. You got to be talking to the anesthesiologist. All right, shot. So what probably happened is she got deeper with anesthesia. Her body collapsed down, like relaxed. Any questions?
No current questions.
Okay, let's go fix that. That's pretty cool. You can see the dye tracking along the L5 nerve root. You see that? Right in front of the sacrum?
We see it, yes.
All right, here we go. Shot. Now she's asleep. We're going in to fix the L4-5 herniation. This is a bigger herniation, by the way. Compared to the bottom one we just fixed, this is going to be a bigger one. Shot. I can feel it. It's huge. Shot. Yep. Go ahead. Again, we're going to have a situation where, where there's going to be some normal disc still there. We're going to leave that stuff alone. We're only going to go after the abnormal disc. Oh, you can see it's pushing the dilator out. Good. Okay, shot. Beautiful. Nice work, Luis. Nice work, Jordan. Everyone, great job so far. This young lady's surgery is going really well. How's she doing over there, Doctor? Stable? We're going to be done in about 10 minutes. You're watching the most state-of-the-art spine surgery in the world for a herniated disc.
Scope on, please.
All done through a tiny 1/4-inch incision.
Thank you.
All right. I need to see up there.
Endo.
All right, beautiful.
Thank
A
you.
lot of inflammation here, laser. Okay, once again, we're at the L4-5, bigger herniation, bigger tear.
Nice off, please. Thank you.
Any questions from our audience? I know her mom is watching.
No current questions.
Mom, her surgery is going very well. I think she's going to be really happy with the results. This is all scar tissue right here, by the way. You don't see scar tissue staining with the blue dye either. The blue dye only stains degenerated nucleus, which we're going to find in a few minutes, but beneath the scar tissue. There it is. Yeah, I told you it was there. You see it?
We see it, yes.
All right. We still have this piece here that doesn't want to leave. Let's go with a grabber. There's your degenerated nucleus. Let's show our audience the alternative type surgery that could be done if you didn't have access to the Deuk laser disc repair. And just do a comparison of the two, side by side, so people can understand the benefit of this particular type of surgery over, say, a spinal fusion.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's half-inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Yeah, I mean, this gives you hope. I can't even explain it. If you're watching this, please, please, please call Dr. Deuk. Send in your stuff. You can upload it. You can mail it in. You can have a Zoom conference with him. Took 10 minutes. And he offers something that no one else does. Yeah, you'll have to travel to Florida. Well, that's real bad. Florida. Well, where I come from, that's a vacation.
And while you're here, you can visit Mickey Mouse.
Yeah, right. I'm telling you, do it.
Good morning, I'm Dr. R. Deuk-Magin. It's September 16th, and we're here with another one of our post-op patients who had surgery done yesterday. Now, he came to us from Pennsylvania, and he has been suffering with back pain for many years. He had a fusion done up in by Dr. Alex Vaccaro, multi-level fusion done, and he developed adjacent segment disease from the fusion. So the disc above and the disc above, so those two, L2-3, L3-4. He was having horrible back pain there yesterday before his surgery. How are you doing today?
I'm doing excellent. I can't even tell you how good I am. It's just like night and day. You come in one day, you're in total pain, had it for years. You go through this procedure that he has, and it's really amazing. You go out of there literally feeling better, and then I'm sure it's going to get even better and better and better. But I'm literally, that pain is gone. I just can't even explain how much different it is.
Yeah. And you were feeling pretty down and hopeless when you came to us at Deuk Spine. How do you feel today?
Oh, way better. When you have chronic pain, especially for years, like you start off going, okay, I can go get this fixed. I can go get this fixed. Well, after years of going through this and then that, you run out of options. You're pretty much hopeless. You don't even want to live, really. You just want to, I don't know, you just don't want to live like how you're living. You want to live, but you don't want to live that way. And now I feel like I can get back to doing some things that I like. It's just,
well, not too soon, because you just had surgery. So we're going to take it easy for a little while. Now you can see in the surgery here, we went in to your L2-3 and L3-4 discs, and we used the laser to remove the herniations and clean up the annular tear. And it's the annular tear in the back of those discs that's the actual cause of your pain. And that's what we were able to treat with the laser endoscopically. So there's only a 1/4 inch incision, which I'm sure you've seen on your back.
This incision is this big. It's unheard of, really. If I was to get another fusion, which was my option, that or a stimulator, were both more invasive than the stimulator more invasive just with that, but then also with the fusion, I would be in bed yet. I would be in bed for another couple of days on a traditional fusion, laying there for 2 to 3 days, wearing a solid body cast for 3 months, and then I can actually start therapy and maybe go back to work at that point.
And you're speaking from experience, because you have the fusion
I've done
already.
I've done all this, and they were my options. They wanted to either fuse or do a stimulator, because I already had a pain pump in that was in, and I was having problems with that. So they were my 2 options. So I literally dug high and low, looked on the internet for everything, found Dr. Deuk, and right away I sent him my MRI. He noticed it right away what it was. He didn't go, oh, it's this or that, or try to guide me in any way. He said, this is what your problem is. This is what I can do. We can help you. Scheduled, came down, boom, boom, boom. Now flying home today, totally different person.
Yeah, yesterday his father said to me right after surgery, when he saw his son walking and standing without pain, he said, you saved my son's life. And what did he mean by that?
Well, anyone out there watching, if you're watching this, you probably had chronic pain and you're looking. And your family gets pretty much the blunt of everything, because you'll go to work and you can't cry at work and you can't complain, and you got to do your job and you got to be pleasant. So you put on an act all day long, but when you get home, your family gets it. Your family, your close friends, and you just release to them. You cry to them. They don't know what to do. I've heard many times from him, Brian, I don't know what to tell you. I can't help you.
They don't know what to do because the doctors don't know what to do either.
And you're just kind of venting to them. You don't really want them to do anything. You just want them to listen. And it's hard, because you should be taking care of your parents and your kids. And here you are feeling helpless, and they don't get it because they don't have the pain. They just, and then people just think you're complaining, or you don't look bad. I seen you smile. Oh, I seen you laugh. But
they don't understand.
You go home by yourself, and it's like, what am I doing? I go, what kind of life is this? I just want to go to heaven and not have pain. And it sounds horrible. You don't want to. You just don't want to live that way, because you're not living.
And do you feel that way now?
No. This gives you hope. I can't even explain it. I can't even explain it. If you're watching this, please, please, please call Dr. Deuk. Send in your stuff. You can upload it. You can mail it in. You can have a Zoom conference with him, and he will know right away. Right over the computer, I did it with him. Right over the computer. Took 10 minutes, and he told me right away what. And by the time you're doing this, you'll kind of know what's out there. You've been through everything.
Yeah.
And he offers something that no one else does in,
That's right.
in the whole world. And yeah, you'll have to travel to Florida. Well, that's real bad, Florida. Well, where I come from, that's a vacation.
And while you're here, you can visit Mickey Mouse.
Yeah,
right?
right. I'm telling you, do it.
All right. Anything else you want to say to your fans out there?
Yeah.
And your father, who's probably
I
going to
just
watch?
want to say my mom and dad are great through all this. My kids, I have a granddaughter. I can't wait to go home, and I won't pick her up because she's over 25 pounds. But that was literally, my granddaughter was the one thing keeping me going. When my granddaughter was born a year ago, that gave me new incentive. I wanted to, be around her, chase after her, and now I can probably do that.
Yes, you can.
And I can't tell you enough. Just call them. Like, don't waste your time even doing some of this other stuff. I did it all. You will be right back to square one. And if you call him, you can still do whatever you're going to do later. You can. Say you want to go get a fusion, you're stuck on that. Come talk to him first. There's certain instances where, yes, a fusion is necessary, but he does those also, a different way too. But there's no harm in contacting him, getting a free opinion. Then you can decide later on. He's not changing your anatomy. Your anatomy is the same. Once you get fused, you're like that. You're stuck.
Yeah, you're right.
But just call him up, and trust me, you'll be happy.
Thank you very much, and congratulations.
Thanks
This
a
is
lot.
why I do what I do. See that smile?
dude.
That's a real smile.
Thank you. I'm telling you, he saved my life.
You're welcome, sir.
Thank you.
You're welcome. I'm Dr. R. Deuk Machen here at the Deuk Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Deuk Spine Institute?
Dr. Deuk, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration where I could maybe get up, stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And
All right, Dr. Deuk Machen here. We've just finished operating on a young lady who comes to us from Tampa with herniated discs at L3, 4, 4, 5, and 5, 1, but only the L4, 5, and 5, 1 needed surgery. Some people do have herniated discs that don't need any treatment at all. The 3-4 herniation is higher up in her back at the L3-4 region. She did not have pain there, and it's off to the right side, which she doesn't have any right leg symptoms. So we left that one alone. We focused on the herniations at L4-5 and L5-S1, which were on the left side, and they were considerable. There was lateral recess stenosis or narrowing, there was foraminal stenosis and narrowing, there was impingement on the nerve roots. You could see it on the MRI on what's called the T2 sagittal images. So to give you an understanding of what I'm talking about, I brought this little model spine here. You can see these white things are bones. They're called vertebral bodies. Between them is a little cushion, and in the back of that there's a herniation from a tear in the wall, and that jelly from the center is squeezed out. It's red color here, It's pushing on the nerves. That's the situation we were dealing with. Now, most surgeons would go in, if you have one level, they'd go in and they would make holes in your spine in the bones and in the joints, and they would go down and try to get some of that stuff out by pulling out little pieces of it around the nerve roots. It's a bad idea. It's called a microdiscectomy. She didn't have one, she had two. You don't do microdiscectomy on two. We would have to do a decompression infusion. She didn't want that. By the way, that's what this looks like. This is a decompression infusion where you're putting in screws, cages right there. And this is a loss of movement in your spine. And of course, that's going to wear out the L3-4 disc, which we're not operating. So she'd come back for more surgery later. With the Deuk laser disc repair, we're not putting any metal or anything abnormal in the spine. We're actually coming from the side instead of the back. And we're going around the facet joint here. We're going right past it, underneath the nerve root, straight into the herniation. Okay? And this technique was developed by Parvis Cambin. He's an orthopedic surgeon at Pittsburgh years ago, taught my predecessor, who then taught me. So we came in endoscopically, went under the nerve root, and cleaned out the herniation through this little space right here called the foramen. That's why it's called the transforaminal endoscopic surgery. The surgery went very well. We didn't have any problems. The L4-5 disc was very swollen as a whole. When I tested those discs to see if the discs were actually painful, indeed both of them were. They were 10 out of 10 pain. So we know that that patient's back pain was coming from those two discs. We fixed that. And her leg pain was coming from pinched nerve in that area. We fixed that as well. I think she's going to do fantastic. I think her back and leg pain will be gone, and she'll be out of here in about an hour from now. This is outpatient surgery. We did this as a bundled package for her insurance company. They wanted a bundled package where it includes the surgeon, anesthesia, all the preoperative stuff that we did, as well as the actual facility fees, and we did that for her insurance company. Yep, I think she's going to do great. Any questions from our audience?
No current questions.
All right, hope you enjoyed the surgery, and we've got one more to go. Following this, it's going to be a young lady who's getting a left L3-4, L4-5, L5-S1 Deuk laser disc repair, and a bilateral L5-S1 Deuk plasma rhizotomy.